It's this weekend, which means it's a good time to maybe have that conversation with mom about her health. Joining us now is Dr. Chad Rogers with the AFMC to offer some ways to have health conversations with mom, not just this weekend, but any time. Thanks so much for joining us this morning.
Having me.
So how do we start this conversation with our mom or with any loved one about the status of their health?
Yeah, it's often sort of a difficult conversation. A lot of times families don't really talk much about their health or health issues. And we all know that moms worry, and that's just the nature of moms. I've been in pediatrics for 20 years and never found a way to deal with that. But it's an important conversation to come. It comes from a place of love and concern. Just kind of knowing what our parents' basic health care issues are, what medications they're on, what doctors they see. Those are real important conversations to have.
Yeah. So why is it important that for a parent to list an adult child to have access to their health records?
Right. So as your parents age, they may need help negotiating the healthcare system. We've definitely learned a lot from the pandemic, and just overall health concerns. So knowing what your parents, want, is the first thing. Is also talking to them about who's going to be sort of that decision maker in the family. So women are actually often the ones that are the big decision makers in the family. Anyway, it's not just for their own health, but for their children and for their parents. So kind of knowing who that person is and making sure you have the legal power to make those medical decisions, and also talking with an attorney about getting that authorization to make those decisions.
Yeah, and I'm sure when it comes down to a situation like that, it's probably your mind's not in the right place, so it's probably good to have all that done in advance. So I know a lot of people with the pandemic, people were missing out on their annual checkups. Do you think we'll see a rise in diagnosis because many people have put off those annual checkups?
Prevention is kind of key in good health. And during the last year, a lot of people were sort of discouraged or afraid to go to the doctor. So a lot of people have kind of postponed those kind of routine checkups and those routine procedures, even things like colonoscopies and things like that. So we do kind of have some concern that people have missed those opportunities to kind of screen for diseases. But also when it comes to immunizations, there's a lot of important shots for people to get in order to stay healthy. And so now it's kind of the time to get back in and get to see our primary care provider.
Yeah. Is there anything else you think people need to know when it comes to talking with our loved ones about this?
Yeah, I think, the great thing about, Mother's Day is it is an opportunity to talk with your mom, because there's some things for yourself as well as when it comes to family history. As I said, moms are often the ones that make medical decisions for the family. So knowing about, what you have in your family, whether that's high blood pressure, high cholesterol, is there real illness in the family you need to know about, not just for your parents, but for yourself.
Yeah, good advice there. Thanks so much for joining us this morning.